So the December MEC Minute is going to be about the COVID-19 vaccine, and I'm recording it now because the vaccine is now available, and there's a lot of discussion about whether or not EMS providers should take the vaccine or should they take a pass. So I would like to enter into this conversation. I would like to encourage everybody to think about what we talk about, and I really, for everybody, I think you should agree to take this vaccine when it becomes available for you. And that's what I want to cover in detail today. So what are we going to talk about? Well, I'm going to talk about those things that I think you need to know to be comfortable with the vaccine and to say yes when it's offered to you. So we're going to talk about what is the vaccine. We'll talk some about who should take the vaccine. Just a couple words about who should not take the vaccine, and that's really very few of us. And then what do we do for those members of our organizations who've had previously documented COVID-19 infections? Should they take the vaccine or not? And then I want to go through some myths and the answers to the myths, because one of the biggest obstacles to accepting anything new, and this COVID vaccine is very new, one of the biggest obstacles is getting past those myths and urban legends that we all have to deal with. So let's start with the bottom line. You know, who should be vaccinated? Well, for me, everybody should be, unless you have a documented allergy to a component of the vaccine, or if you've had a serious reaction to the first of the two vaccines that are needed to develop appropriate immunity to COVID. So both of the currently available vaccines require 2 doses of vaccine, and if you have a significant side effect or allergic response to the vaccine with the first dose, then you should probably not have the second dose. But everybody else, I think, should have it. Now, the question has been asked about pregnant and nursing women. Should they be vaccinated? Well, I think the bottom line is yes, they should. I'll talk a little bit about that more in a couple slides. The American College of Obstetrics and Gynecology recommends the vaccine. So unless you have some other reason to not take the vaccine, if you are pregnant or nursing, if the vaccine is offered to you, I highly recommend that you take the vaccine. But I think it's also reasonable to talk with your obstetrician before you take it. So more about the vaccine. What is it? Well, there are 2 current versions available. The first is the Pfizer-BioNTech vaccine. It's the first one that came out. It has an EUA, emergency use authorization from the FDA for ages 16 and up. It was the first vaccine to come out. It's the one that has to be kept super cold. It is the one that some of the hospitals in town have received, or providers have received. The other vaccine, which was just approved a little over a week ago, was the Moderna vaccine. It has an EUA for ages 18 and up. It does not require the intense, very cold storage. It can be just kept in a regular freezer. I think we'll see for our EMS providers that Moderna is probably going to be the vaccine that is offered to you. It seems to be more prevalent, and it's going to be easier for people to handle. It's going to be easier for the Department of Health to manage and get it out to you. Both vaccines are against the COVID-19 antiviral messenger RNA. This is a new kind of vaccine. So it's a messenger RNA vaccine. I'll talk about that in a couple slides. Yes, these are new vaccines. They are actually some of the first mRNA vaccines out there, but there's been research on this type of vaccine going on for decades. Both of them require 2 shots. The Pfizer vaccine has to be 21 days apart, and it is 95% effective. The Moderna vaccine has to be dosed 28 days apart, and it's about 94% effective. And I think that is very good. And you know, for those people in these studies who developed infections related to COVID, even though they were vaccinated, they did not get as sick as you would expect them to get, and there was nobody who had severe illness. So this is really similar to why we use the influenza vaccine. We know that influenza vaccine will prevent flu in some people. And for those who do get infected, they are less likely to become critically ill or suffer the adverse effects of influenza. So it's not just keeping you from getting the infection, it's also helping you that if you are the unfortunate one who gets infected, your symptoms are less severe. And I'd also like to point out that influenza vaccine is typically around 70% effective, or we're very excited when it's 70% effective. There have been a couple years, like last year, the vaccine for influenza was 40 to 50% effective. Well, we're talking about 2 new vaccines for a new deadly disease that are 94 to 95% effective, meaning they prevent infection in 94 to 95% of the people who have the vaccine. I think that's incredible. That speaks a lot to the efficacy of this vaccine. So what is Messenger RNA, a messenger RNA vaccine. Well, the coronaviruses are kind of dumb viruses. Most viruses are dumb. Viruses require host cells to reproduce. The viruses themselves cannot reproduce on their own. Coronaviruses are known as RNA viruses, so they're DNA viruses, there are RNA viruses, but coronaviruses are RNA viruses, and they use messenger RNA to instruct infected cells on how to make the proteins necessary to reproduce and replicate the virus. So COVID messenger RNA is a single-stranded molecule of RNA that is read by a host cells. It's read by the host cells, and the ribosomes read these strips of code to synthesize a protein. And the mRNA vaccine that we use now is to prompt cells to make the spike protein, which is what we talk about, the proteins on the outside of the viruses, these spike proteins. So the mRNA vaccine that comes from Pfizer and from Moderna tells the cells to make spike proteins. It doesn't make the whole virus, it just makes the spike protein. How does this work? So this is just a generic slide for messenger RNA. So in the top left, you see this messenger RNA that has been encapsulated in special protein. It's a delivery vehicle, it's synthetic, and that is then injected or put into your body. The cell will pick it up, and the cell will take that messenger RNA, it'll break down that membrane that's around the messenger RNA, and the ribosome there on the right-hand side is basically reads the code of the RNA. So it reads the code, and the code says, make protein. And that protein can either be a protein that's excreted from the cell, it could be a protein that stays within the cell and to do something else, or it can be a protein to form or to make protein that sticks on the outside or through the wall of the cell. And that is what the COVID vaccines do. They cause this transmembrane protein to be developed, which is a piece of spike protein. So it causes those spikes to form on our regular cells. And that's what happens, and that's what our body detects as being a abnormality. That's what prompts our body to develop antibodies and cellular immunity. So it's that protein that is then developed. The body recognizes it being abnormal, and we develop immunity to it. I also want to point out that this nucleus on the bottom of the slide, the nucleus is where our genetic material is stored. That's where our DNA is stored. The messenger RNA does not go into the nucleus. It does not interact with our DNA. It's not going to cause genetic abnormalities in us as human beings, simply because the messenger RNA doesn't get into the nucleus. It has no interaction with our DNA. Here's another slide that pretty much says the same thing. On the left-hand side, you see that the spike proteins are on the COVID virus. We take those proteins, we find the messenger RNA for them, we encapsulate them in some fatty material called little nanoparticles. These are not nanobots, they're nanoparticles. Those particles are injected into the body. They are absorbed by the host cell on the right-hand side. The messenger RNA is released from that coding. It goes to the ribosomes. The ribosomes interpret the code and produce cell protein, viral protein, which then goes out to the cell wall and sticks out like a little piece of spike protein recognized by our immune system as being abnormal. That's what develops our immunity. So who should take the vaccine? Who should not take the vaccine? Really, it's pretty straightforward. If you have a documented allergy to a component of the vaccine, you should not take it. That is very rare. It's not the same thing as you get a flu shot and your arm hurts or you feel like you're sick. That's your body responding to the vaccine. It's you have a true allergic reaction to a component of the vaccine, which is usually a preservative or some of the other chemicals that might be in the vaccine to help stabilize the material in the vaccine until administration. So anyone who has a documented allergy to a component of the vaccine, or again, anyone who had a serious reaction to the first dose of the vaccine. So it's two dose series of vaccines. You get that first dose and you have an allergic reaction. You probably should not have a second dose unless you're evaluated by a physician. But we would probably make a determination of second dose, yes or no, based on the severity of your allergic reaction. If it's some simple hives, we may just say pre-medicate with some Benadryl before you take the second dose. But we just don't have enough information yet. Pregnant or lactating women, it's the American College of Obstetricians and Gynecologists recommends the vaccination with the Pfizer product. They haven't commented yet on the Moderna product simply because it came out after the Pfizer. But really, from my perspective, I don't see any difference between the two in terms of whether or not you take the vaccine if you're pregnant or if you're lactating. If you are breastfeeding, this messenger RNA is not going to be excreted in your breast milk. And if it was, it probably would be neutralized by the baby's stomach acid. So it's not a risk to the baby. If you are pregnant, we typically look at a perspective of, yes, the virus in its native form is probably much more dangerous to you and your baby in the pregnancy than any potential risk from the vaccine. But I would suggest if you are pregnant or if you're breastfeeding, talk with your physician first. But again, all the experts so far say, based on the information they have, you should take the vaccine. So why should you take the vaccine? So, well, we should take it because COVID is a pandemic, and we need it. We need to get out of this pandemic, and vaccine is an important way to get there. The so-called herd immunity, that's not going to happen unless a lot more people die or a lot of us get vaccinated. So we have to end this pandemic. If also another reason is most of our providers in the past 9 months, most of our providers who have developed COVID infection have developed an infection because of an exposure to a friend or family member or some other member of the public or from coworkers in the station. They are not infected because they failed to use PPE with a patient or we had a PPE failure. So most of our exposures are from circumstances where we may not be totally up to doing what we should be doing to protect ourselves. The fatality rate of this virus right now is about 2%. It's been as high as 5%, but I think it's down to 2% in large part because we're better at finding the less acutely ill, less severely ill patients through testing. Plus, we're better at managing the disease and those who have serious side effects of the infection. But the fatality rate is still 2 to 3%, which is 20 to 30 times greater than influenza. Yes, you're young. Most of us are younger than the geriatric population, but if you look at the mortality rate and the deaths in Ohio, 9 to 10% of those people who die from COVID are under age 60. And you don't have to be a 75-year-old with 3 significant chronic illnesses to die from this disease. It's not common, but it still happens. And then for those who don't die, there could be significant morbidity. In other words, significant symptoms of illness, even though they're not life-threatening. And those symptoms can hang on for weeks to months. I see patients who've had a cough for 6 to 8 weeks, patients who have terrible fatigue that's ongoing for weeks on end, headaches that won't quit. So there's a lot of symptomatology related to the illness that can be avoided by taking the vaccine. It's especially important if you have chronic lung disease, if you have diabetes, if you have hypertension, or if you're obese, that you take this vaccine. So if you have any chronic illness, if you're immunosuppressed in any way, you should take this vaccine to reduce your risk of infection and, more importantly, complications of the infection. So I would encourage everybody to take it. Side effects. We've had some reports of anaphylactoid type or anaphylaxis-like reactions. That's the most severe reactions that are out there. All of them that I'm aware of responded to the typical treatment of epinephrine, Benadryl, and maybe steroids. And many of the people who have reported anaphylactoid type reactions or anaphylactic reactions are treated and within an hour or two are well enough to go home. This is not very common. Common side effect is some pain or tenderness or swelling at the site of injection. Sometimes you can actually get swelling of the lymph nodes in your armpit because of the injection in the arm. These are all transient symptoms that tend to get better over a couple days. You can also develop general fatigue, headache, myalgias, arthritis, chills, nausea, vomiting, fever. These are all symptoms that can occur with this vaccine and with others. And it's simply an indication that your body is responding to the vaccine and it's developing a true inflammatory response to the vaccine. To me, that's a good thing. It means your body says, hey, something's not right with this substance. I need to fight it off. These symptoms are much more common with the second dose, more severe with the second dose. So, I've had my first dose. I'm waiting for the second dose in 3 weeks to see how I respond. I know that I pre-medicated with Tylenol, and I did just fine. The younger seem to have more side effects than the older. I think it's probably related to the younger patients having a better or stronger immune system, and their body is responding to the injected viral mRNA or RNA. So it's just like we see the younger people having some of the more inflammatory reactions to the native virus. Patients who have the virus and they develop all these inflammatory conditions like significant lung injury and so on from the inflammatory side effects of the virus. It's probably related to the revved up immune system that we see in younger patients. If you get the vaccine, you'll probably get some information on the CDC's V-Safe program, the Vaccine Safe program. It's a way of collecting data. You'll probably get a link that you can scan, a QR code that you can scan and sign up. And this is the way the CDC is collecting data. It's secure. You don't need to worry about it showing up on some web page. It is secured information. It's a phone app, and it's very confidential. And if you sign up for it, they will text you a message every day for a week, and then weekly for 5 more weeks. They'll also send you a reminder that, hey, it's time to sign up for a second shot, although my experience is if you get the first shot, they're already scheduling you for the second shot before you leave. And then you go through the same process after the second dose. And they say that there's going to be follow-up questions at 3, 6, and 12 months. Participation is optional, so you can opt out. You don't have to do this. Nobody's going to withhold the vaccine if you don't participate in the CDC program. But I would encourage you to do it because it gives the CDC an idea of what are the side effects of this medication. It's a new vaccine. We've had very few months of experience with it, so this is a way of collecting data quickly and easily to get an idea of side effects of the vaccine. How do we treat the side effects? Well, if there's a true anaphylactoid or anaphylactic reaction, it's epinephrine and then maybe some Benadryl. If you're talking about a local reaction, it could be cool compresses at the site of the injection. Most of the symptoms can be easily controlled with ibuprofen or Tylenol. If you have any concerns about whether or not you may have a significant side effect, pre-medicate before you go in. So an hour before your shot, take a dose of Tylenol or ibuprofen and then take it on a scheduled basis for a couple of days. And then also drink plenty of fluids. The other thing to think about is where in your work cycle do you take the vaccine? My suggestion would be if you had the vaccine available, take it as you're coming off shift so that you have a day or two to recover if you have any side effects, particularly with that second dose, if the second dose is more likely to cause side effects. So you might think about getting vaccinated as you're coming off shift so you have a couple days off before you go back to work after getting the vaccine. How about if you already had COVID? Well, if you've had a documented COVID infection, the CDC still recommends that you be vaccinated to a large extent because we don't know the duration of immunity from a previous COVID infection. We've had a couple providers who've said, hey, I've recently had the infection. I'm in a position where I can get the vaccine in the next week or two. When can I have the vaccine even though I had a recent infection? And from what I can tell, the CDC current recommendation is that if you have improved and you qualify to come back to work, you can come out of quarantine, then you are a candidate for the vaccine. So if it's been 10 days or more since you had onset of symptoms, you no longer have a fever and your symptoms are improving, then you can have the vaccine. Another question that's been asked is, do I use PPE after vaccination? The answer is Yes. So here are my reasons. The first is, I said it's 95% effective. 5% of people do not develop protective immunity. So where are you going to fall? You're going to be in that 95% or the 5%? We don't know. So wear a mask. You have to think about who around you has not been vaccinated. So, if you go out in public, you really want to be unprotected at this point in time when you don't know who may be a source of infection. There's also, we know that there are been some cases of reinfection in patients. So, they're still at risk for reinfection, so you should continue to use PPE. We don't know the duration of protection from the virus or from the vaccine, so, protect yourself. We also don't know if those who are vaccinated can still spread disease. So we know from other vaccines that if you are vaccinated, let's say you're vaccinated against pertussis or whooping cough, then it's very unlikely you will pass that infection on to anybody else if you are exposed to it in the community. So it's not that you can, with pertussis, if you have the vaccine, you're not going to be a carrier. We don't know about COVID. We don't know if you can be a carrier even though you're vaccinated. So wear a mask to protect others. And then, the last thing is this is a bad disease, and we need to continue all steps to reduce the risk of exposure, reduce the risk of transmitting the virus, and end this pandemic. If we stop wearing masks, then we really are reinforcing for others that maybe they don't need to wear a mask as well. So continue to wear the mask, continue to use PPE. I'd like to now tackle some of the myths. The first myth is that the vaccine is not safe. Well, it's not true. The studies, we've been studying mRNA vaccines for years, if decades really, and there's been no evidence this technique or this type of vaccine is unsafe. You can get COVID from the vaccine. That's not true. The vaccine is non-infectious. What we're doing is being inoculated with messenger RNA, which is telling our bodies to develop spike protein, and we are developing immunity to that protein. There's not enough genetic code in the messenger RNA to develop a full COVID-19 virus or a full coronavirus. This is just a portion of the virus that we're being inoculated for. Another myth is the vaccines will alter your DNA. That's not true. As I pointed out on one of those first slides, messenger RNA from this vaccine does not enter the nucleus. It does not have an opportunity to mix with our own genetic material, so it's not going to alter our DNA. It will cause a positive nasal swab. No, that's not true. The vaccine is not infectious. It's not going to pass anything on. It's not going to make these proteins to be secreted in our nasal secretion, so it will not cause a positive nasal swab. Vaccine contains microchips. I kind of laugh on this one, but it's not true. But we do know that RFID chips may be in some of the shipping containers simply so they can track the shipment and to maintain security of the vaccine. Putting RFID chips in the box for tracking purposes does not mean there are microchips in the vaccine. And then the vaccines cause autism. Two comments on that. First off, there's been no scientific evidence that meets the rigors of scientific study to show vaccines cause autism. Plus, we're talking about vaccines that are not yet approved for anybody under age 16. Autism starts well before age 16. So if you're worried about autism in this vaccine, right now it's not going to happen because the at-risk population for autism is not currently eligible to receive the vaccine. So I would not use these concerns about autism as a reason to avoid the vaccine. So in summary, the COVID vaccine is safe and very effective. It's our best option in dealing with this pandemic. There are side effects of the vaccine that can be mild to moderate severe, but they're easily controlled. And we can do that with cool compresses as well as Tylenol or ibuprofen. Again, you think about pre-medicating before your vaccine. There have been reported anaphylactoid reactions that respond promptly to treatment. The true incidence is unknown. And for me, what is important is, what is the incidence with this vaccine versus other common vaccines, particularly in adults. So what is the incidence of a true anaphylactoid reaction in a patient or a population of patients receiving the influenza vaccine, and how does that compare to what we'll see in the future with this COVID-19 vaccine? It's another reason why I would encourage you to participate in the V-Safe program through the CDC, because if you have significant side effects, they want to know about it so they can compare the incidence of side effects for this vaccine against other vaccines such as influenza. Everyone should take the vaccine unless documented allergy to a component or severe reaction to the first dose. Again, if you are pregnant or nursing, discuss with your doctor first. And the last thing is really continue to use PPE after vaccination. We have to take a multiple-tiered approach to this virus to end the pandemic. Vaccination is one of those tools in the toolbox, but it's not the only one. PPE is the second best tool, with vaccine being the first. We need to continue using PPE until we're out of the woods. And we've got, at least in my mind, another 3 to 4 months minimum before we really see the light at the end of the tunnel. That's all I have on this. If you have any questions, please send me an email. Appreciate your time. I hope you had a good holiday season and have a safe and happy new year. I look forward to talking with you again next year. Thank you.